With Kelly today, we're going to provide a fraxel treatment to her skin. And what fraxel laser is going to do is it's going to inductively stimulate collagen and elastin. That'll thicken up the skin. It's going to also provide a little bit more resiliency to the skin, a little bit more of its elasticity. It'll also clear up some of the pigmentary changes that I've seen. So it's a very beneficial treatment. We do use a little bit of a topical anesthetic on this to make her more comfortable. There are 3 settings, a low, medium, and high. This is based on the patient's tolerance. And if you have any trouble at all, it has a roller tip here, which really basically, you can hear the machine say, creates a very nice, even application. It's almost like a feeling of pins and needles as we go across here. But how's your comfort level, Kelly?
It's good.
It's good? You have any difficulty at all?
No.
You may have a sensitive area overlying some area of the forehead. You may have a sensitive area, say, in the upper lip. But what we're going to do is essentially, from that artistic standpoint, everybody knows my artistic background, I'm treating this very much like a nice little paintbrush. And we're painting the surface of her skin and inducing that collagen and elastin formation. It's a very safe application. Because it's roller tip, the laser will not fire unless it's in contact with the skin, and it only fires in the direction that 2 contacts of the rollers are. So there's a safety element in here involved. You don't have the difficulties with areas of overlap. It's a nice smooth application. As I said, very much like painting. Now we go in one direction, we'll work back through the other, and this gives us a good coverage. Now, effectively, we may be anywhere from 15 to 20 to 25% of the surface of the skin that is being effectively induced through this laser treatment. I kind of liken it to aerating the lawn. This roller bearing kind of aerating the lawn and creating at 400 microns depths and levels the inductive stimulus to increase that collagen and elastin formation in your skin. And so it's a very precise method of accomplishing it, and again, with no downtime or very little downtime if you consider this as nothing more than a little bit of a sunburn kind of effect. And you can actually see now this area that we've treated in induction, the kind of the thermal induction and the redness and that sunburn kind of look. Move to her forehead. The forehead tends to be a little bit more sensitive area for some people. We can always dial back the energy if they feel a little bit more discomfort, so we can make it perfectly comfortable for each individual. And it's an application, as I said, that occurs every 2 weeks. You need a little bit of time to go through a process of healing, of stimulating that collagen and elastin. And that's why we say somewhere around a 2-week period of interval between treatments is ideal. And in the next couple of days, what Kelly will find is that even though you won't see it, you actually have a little bit of a texture to the skin, almost like a little bit of sandpaper. And it's just the feel of that surface. And so you know that that particular treatment has really caused the effect that we wanted to see. Now, a single treatment will show you results, but as I said, coupling together 4 to 6 to 8 treatments as you feel necessary is going to give you effectively more coverage. This particular fraxel, unlike most others that have almost a week of downtime, this one has very little, about an hour to an hour and a half in which you kind of look like you have a little bit of a sunburn. But I will tell you, this is an effective treatment. This is a scientifically proven basis. We can see microscopically at the skin level what occurs. We know it's of tremendous value to the patients, and that's what we provide. You know, surgery is of particular value, in patients at different times in their lives. But the non-invasive, the non-surgical modalities, of course, are things that we offer patients as well, because they may not, in their busy lives and busy times of their lives, have time to pursue a surgical procedure. They may not even need it at that time. But in pursuing a non-invasive, they can get the benefit of the scientifically based and proven value, dollar for dollar, pound for pound, something of significance for them. So effectively we've got Kelly's face treated here, and you can see, as I said, that little bit of a sunburn effect. It'll feel a little bit warm, but we'll get a cooling balm on her. But we often in a treatment, we can treat the face as a single treatment, but a lot of our patients elect to go ahead and treat the area of the neck and the area of the anterior chest regions. All right, now Kelly's gotten a full set of treatments here, and she's good to go. Let's get a balm on you. All right, we'll just do is you go ahead and rub the balm in. You'll find that that's going to be a nice.
It does feel just like I got a little sun.
Yes, that's right, and just that sun application. And that soothing balm really kind of quiets it down a little bit. Yeah, you know, and just by quieting it down a little, go ahead and take care of the chest and those regions, and then I'll give you a little bit to apply to the face.